Okay, so first of all, I would like to appreciate greatly to Professor Zhongming Li for inviting me to attend the this year's Golden Bridge International Urology Forum. So today my talk will focus on the innovative bipolar enucleation of the prostate. So as far as we know, so there are many different methods for anatomical enucleation of the prostate, from open prostatectomy to a different laser enucleations and bipolar enucleations and laparoscopic enucleations, even robot-assisted enucleations. So let's look back to the anatomy of the prostate. So BPH originated from the transitional zone, and it compressed to the peripheral zone. And between peripheral zone and transitional zone, it is formed the surgical capsule. So theoretically, if we would like to enucleate the prostate, we should do in this way to enucleate the enlarged prostate within the along the surgical capsule. And second is as far as we know, the prostate has a rich blood supply, just like the picture shows here. So how can we avoid bleeding? That's a very important issue. So from a case of our patient here, the arterial angiography shows the real world blood supply of the prostate. This is right, and this is left. And we do a merge. So look at here. So that means when we cut the prostate, each cut, it will bleed. So how can we avoid the bleeding? That means it is always better to avoid troubles than to get out of the troubles. So we put forward a concept of pre-homeostasis. Pre-homeostasis. That means we can stop blood, we can seal blood vessels in advance to avoid bleeding. So we can carry out the enucleation in a blood-free way. So our team from 2011, we have used the button electrode to develop 3 different innovative enucleation of the prostate. The first, we call this transurethral vapor enucleation and resection of the prostate. We call this TVRP. That means we use the button to imitate our surgeon finger, and we use the vaporization function to from 5 o'clock and then 7 o'clock to find the surgical capsule. And then we allow the surgical capsule to enucleate the enlarged prostate. And during these procedures, we can stop the bleeding in advance. And then we keep the enucleated prostate approach to the blood neck and then transfer to the cutting loop and resect. We call this TVRP. And we publish this in Journal and Urology, and our long-term outcomes show very good results. And the second innovative procedure is we learn from the whole labs, and for the large prostate, we can enucleate the use button electrode to enucleate prostate into the bladder, and then use the Morcellator to retrieve the specimens. So we call this transurethral vapor enucleation of the prostate. We call this TVEP. And third technique we develop is how can we identify the surgical capsule and the prostate apex and the blood neck, even the external sphincter precisely. So we introduce the technique of transrectal ultrasound to monitor, to guide, to navigate the whole procedure of the enucleations. And look at here, very important here, this is the prostatic urethra, and this is the enlarged prostate. And here is the peripheral zone. And between the enlarged prostate and peripheral zone, here from the ultrasound, we can clearly look at can see the surgical capsule. And more important is here, we can look the external sphincter. And from the at 6 o'clock, from the point proximal to the verumontanum, we measured the distance is about to external sphincter is about 1.5 centimeters. So we developed the third technique. We call this ultrasound navigated TVRP and TVEP. And we can enucleate anatomically to seal blood vessels precisely and to resect the prostate in a blood-free way and fitting the search capsule. So can we further develop the technique? So we think it over. Can we develop a new tool, a multifunctional prostate enucleation scalpel? So from a very important inspiration, that means the plow the field. We would like to design a very special tool. We call this Emperor Yu scalpel or Dayu scalpel. Why we call this? Because we designed this tool, this scalpel, and why we name this Dayu scalpel or Emperor Dayu? Because he is a severe hero combating the flood and the reputed founder of the China's Xia dynasty. You know, about 4,000 years ago in China, we combat the flood, always how to block up, but it doesn't work. But from Emperor Yu, he found these dredge to dredge the flood. So that's very important. So here we find a balance between block up and dredge. Also the same way for BPH. So we name this multifunctional prostate enucleation scalpel as Dayu scalpel or Emperor Yu scalpel. So look at the, so we use the equipment is this is a Dayu scalpel, and this is the Dayu macro pulse intelligent multifunctional energy platform. And also we use our own designed blue whale intelligent tissue modulating systems. And look at the video here. So first step, we from the 5 o'clock to find the search capsule, and second from the 7 o'clock, and then to link between 5 to 7 o'clock. And fourth step is to enucleate the right lobe, and the fifth step is the left lobe, and the sixth step is to the 12 o'clock. And the last step is to modulate this. So look at the video here. So look at this video. This Dayu scalpel. Look at here. First, we will make the mark just at the 6 o'clock, proximal to the viral mountainum. From here, at 6 o'clock, from this point to external sphincter is about 1.5 centimeter on average. And the first step, we use the Dayu scalpel to enucleate the prostate at 5 o'clock. In this point, it's very easy for us to find the search capsule. When we get into this right plane and we enucleate the enlarged prostate along the search capsule, and during this process, and when we meet the blood vessels in search capsule and in the hyperplasic prostate, we seal the blood vessels, stop blood bleeding in advance. Then we can always keep our view quite clean. Just like we use a plow to plow the field. Okay, this is a video here. And the second step is at 7 o'clock in the same way. And also at 7 o'clock, we get to the right plane of surge capsule. And then the third step is to connecting 5 and 7 o'clock. Look at here. We use the vaporization function. Because we have done the pre-homeostasis that will help us to keep our surgical field quite clean, and we can, in a very good way, to put forward to push to carry out our enucleation procedures. And here, please pay attention to this. We can keep to preserve the blood neck intact. Then we get into the bladder. Look at here. Okay, and then the fifth step to enucleate the left lobe and, in the same way, the right lobe. Please look at here, the Dayu scalpel is a special shape. It's quite well fitting the shape of such capsule. Okay, and then the sixth step is 12 o'clock. And also at 12 o'clock, we can also get into the bladder and keep also the bladder neck at 12 o'clock intact. Look at here. You can look at the circular fiber here at the bladder neck. And look at here. This we have made the mark. We can keep the mucosa here very well. And this mark to the external sphincter is about 1.3 centimeter. So that's quite safe for us to protect the external sphincter. And the last step, we retrieve the specimen. We push the prostate into bladder. And so we can use the Dayu scalpel to resect, to vaporization, to coagulation, and to enucleate. Okay, and then we use the blue wheel to morcellate the enucleated prostate in a safe way, because the blue wheel will not damage bladder. It's bladder friendly. It's intelligent. Okay, then we finish this procedure. So we have found this the plus advantage of the Dayu scalpel. So first, it is arc-shaped and fitting the surgical capsule, the enucleation layer, enucleation plane. And the second is that because it's had the rigidity, it's fine rigidity and very well controlled. So we call this a fine controllability. It's easier for us to carry out the enucleation. And the third is the Dayu scalpel is with a wide area, and we can quick and complete homeostasis. And the fourth advantage is it is panoramic display, and we enucleate under direct vision. And fifth is very important is we can use one scalpel for multiple purposes: enucleation plus electrocoagulation plus vaporization and resection. And the sixth is the highly cost-effective, and we can reduce the treatment cost, and will help us to reduce the medical costs. And the plus is that means because each urologist we are quite familiar with the TURP, so we don't need to change our mode for manipulation. So we familiar with this operation procedure. So it's easy for us to learn. Especially for young colleagues, and we shorten. For innovation is never stop. So I think it's everything is we can do not the best, but always we can do better. So thank you very much.
Okay, thank you.